Hello, everybody. My name is Larry Kilgore. I'm the GYN oncologist here in the University of Tennessee Medical Center, and here we are celebrating Comedy for a Cause 2020. Thank you for attending, and thank you for supporting all of our efforts in GYN oncology and for all of our patient activities and education. And you are so important to us, and we are most grateful. Grateful also to be able to serve our patients and the community and its needs in GYN oncology. Today I'm going to update you very briefly on ovary cancer. And of course, ovary cancer has some sobering statistics, and those continue to be problematic for us. Some of those are exacerbated by the pandemic that we're currently working and living in, and I want to address those just very briefly. Ovary cancer is the second most common cause of cancer death in women worldwide when we consider the GYN cancers. It ranks only behind cervix cancer as a killer of women worldwide. It also has improved in its survivorship, and so we're very pleased about that. But that's still also sobering because the 5-year survival now for an ovary cancer diagnosis is right around 50%, which is much better than the 10 or 15, 20% it was when I was a young GYN oncologist. But breast cancer, for example, has an 85% 5-year survival, so we still lag behind breast cancer. We've improved, but we're not there yet. A more sobering statistic even more is the fact that 1 in 6 women who are diagnosed with ovary cancer lose their life within the first 90 days of diagnosis. And of course that reflects the fact that the majority of our patients are advanced stage 3 or 4 when they're diagnosed. And this is the part of the statistics that is getting worse during the pandemic, where access to care is limited. People have lost their jobs and transportation, they've lost their insurance, and they're a little bit fearful to come in, not getting to their primary care doctors, not getting these symptoms seen about. And so we are suffering ever more from that. There are areas of good news in ovary cancer, and I want to focus on those just briefly. As I said, we have improved the 5-year survival for ovary cancer patients. We still do aggressive surgery appropriately, and we have great facilities for that. We continue with the chemotherapy as frontline therapy, and now at frontline it is supplemented by a drug called Avastin. But more importantly, we now have an opportunity for maintenance therapy in almost all ovary cancer patients. This is wonderful news. Most of that maintenance therapy is with a group of medications called PARP inhibitors. And for those of you who are watching this video who are ovary cancer patients or survivors, you're very familiar with PARP inhibitors. Many of our patients are now on PARP inhibitors for 1, 2, 3, 4 years even, and hopefully that will continue. We are moving that survival statistic up and improving with our ability to maintain patients who have responded to therapy for quite a long time. The other thing is precision medicine, and many of you see that perhaps advertised in the media, on television. And we are extensively involved in precision medicine at UT Medical Center and have been for quite a long time. Precision medicine allows us to look into the ovary cancer's heterogeneity, I should say, and that is that every ovary cancer patient is a little bit different. Every ovary cancer is different in itself, and there are opportunities from the genetics of that cancer to allow us to tailor your therapy much more specifically and make modifications on the fly as we move through your therapy to give you a better chance for cure. The support that we have for our ovary cancer patients with integrative health, our nurse practitioners, our nurses, all the people that help us take care of patients are there to add quality to your experiences with cancer, which are difficult and challenging. But we're optimistic about the future for ovary cancer, and we continue our efforts to try and make this a chronic illness that is similar to diabetes or hypertension. We may not be able to cure every case of ovary cancer, but we want those patients to live as long as they possibly can, to prosper and enjoy their families and their lives, and to continue on with their families and lives that are upcoming. Thanks again for attending, and thanks again for sponsoring this wonderful effort to celebrate comedy and to celebrate our GYN oncology patients and their families. Thank you.